Welcome to my low back pain portion of my website. We're going to knock this out in about 5 minutes. I had a longer video here before, but people would get bored much earlier than halfway through. So we're going to try to knock this out in 5 minutes. This is the spine. This guy's made of plastic, by the way. It's not real, so I'm not holding a dead man's spine in my hands, so relax. Spine is made up of 24 blocks called vertebrae. You can see each of these blocks, and in between each of these blocks, we're going to have a spinal disc. Spinal discs are made up like jelly donuts. They have a thick, hard outer shell, and inside of that shell is liquidy jelly material called a nucleus pulposus. That jelly material is actually living cells. Now, discs don't actually have arteries and veins that puncture through them to get blood to those cells on the inside. And every cell in your body needs oxygen and it needs blood to live. No oxygen, no blood, the cells die. So the discs survive by spinal motion. Every time you move, it serves as a pumping action to get good stuff in, bad stuff like waste products out. When a person gets injured, what usually happens is either it's some kind of sport injury, or it's an injury that happens to somebody that, I don't know, may sit at a desk a little bit too often, like 40 hours a week, doesn't exercise enough, doesn't have proper muscular control of their body. So they go to lift or move something and they move too far and they end up ripping something, usually the spinal disc. When you rip a spinal disc, it has a lot of nerves to it. So when you injure a spinal disc, that's going to be bad, bad pain. And for the low back area, this is the pelvis, this is the hip, the low back area, spinal discs are by far and away the #1 generator of low back pain. So if you have pain in your low back, you probably have a low back disc problem. Other names for that are herniated disc or bulging disc, slip disc. Anything that sounds like that is a spinal disc injury. So a person moves too far, they rip something. Well, what happens when you do that? Well, muscles in the area are going to tighten up and try to brace that spinal disc. It's kind of like when you put somebody's broken arm in a cast. That's great because you don't want that to move. You want it to stop moving because it just got torn. The best way, if you're going to rip something, the best thing you're going to do is stitch it up and then get the person to stop moving so that way the stitching can heal. Well, not the stitching, but the skin can heal. Same thing with the spinal disc. Muscles will tighten up to try to brace that problem. The problem with that is when the muscles tighten up, it severely limits how that spine moves. And if the spine doesn't move, the living cells inside of that disc can't get nutrients like oxygen and blood inside of them, and the cells begin to die. And when the cells die, the disc dies. When the disc dies, that's called degenerative disc disease or herniated disc or bulging disc. What we do for low back pain there's 5 steps to taking care of low back pain. The first step is going to be symptom control. So the first thing you're going to want to do for patients is give them medication. And if your spinal problem is bad enough, we will probably make a referral to a neurologist or to an orthopedist for medication to help control the symptoms. It's great to not like medication and complain that medication is the root of all evil, but if somebody has a bad enough disc problem, they're not going to be able to sleep or function unless you get those symptoms under control. So if you come into my office and your symptoms are terrible, we're probably going to make you a quick referral to a neurologist and orthopedist so you can get some medication to help control the symptoms and get you at least feeling a little bit better. Once your symptoms are under control, and if you're in pain but you're not in such bad pain that you can function and you're past that stage anyway, the healing stage begins, and this is an extremely important stage. If this does not heal up properly, if the spinal disc begins to heal but the muscles in the area that are tight stay tight, when muscles are too tight, they suffer rips and tears. Those rips and tears heal up with scar tissue. A muscle that has a lot of scar tissue in it feels like a knot. And if you ever rubbed anybody's shoulders and felt knots, those are little balls of scar tissue. If a muscle has a lot of knots in it, it can't stretch, so you lose flexibility, and it can't fatten, so you lose strength. So if the spinal disc heals up, but the muscles in the area are real tight and restricted and laden with scar tissue, that's going to affect how the spine moves. And we just talked about if the spine doesn't move, the disc can't get oxygen and nutrients inside of it, and the disc will begin to die. Now this could take a long time. This could take 3 or 4 or 5 years. But 5 years after an accident, you suddenly have terrible low back pain, and you go to get an MRI, and the doctor says, your disc is practically dead. There's no disc there at all, and we need to do surgery right now to fuse those bones together so that you don't run the risk of damaging your spinal cord or damaging some of the spinal nerve roots that come out between each bone in your spine. Once you damage those nerve roots, you can have problems like not being able to hold your bowels or your bladder. Could affect the way you walk, could affect strength in your leg and feeling and sensation in your leg. Those are all not good things. So before that happens, you want, when the patient suffers an injury and they get over the initial stage of pain, you want to make sure that they heal properly. A patient that heals properly has a much smaller chance of having re-injury or chronic pain in the future than a patient that heals badly or doesn't heal at all. So you want to use hands-on techniques to get in there and break up the scar tissue and the muscles and help gently get the joints moving. Now when I say get the joints moving, I don't mean twisting and cracking the spine. There are more gentle ways of getting spinal bones to move. Since muscles move bones in the first place, it would make a lot more sense to focus on the muscle tissue than just trying to twist and pop open a bone. So you want to break up scar tissue in the muscles, and you want to train that patient exercises to help keep their spine stable when they move, so the next time they go and lift something, they don't suffer a tear to the disc. The muscles are able to stabilize and control movement in the spine, so the movement happens in a nice, smooth, and controlled manner. It keeps the disc safe, keeps the bone safe, keeps the joints safe, and it decreases the chance of you suffering from an injury in the long run. Now, physical therapists do a fantastic job in terms of exercises. You go to a physical therapist, they will assign you exercises to help strengthen your abdomen, your core, and help strengthen the glute area and all the different spots, different muscles that are involved in moving and controlling and protecting the spine during movement. But a lot of physical therapists do not do hands-on techniques, and if you have muscles that have knots and scar tissue in them, if you have joints that are not moving properly, you're probably not going to be able to do those exercises, which is why exercise alone normally does not do a great job for low back pain. So what we do in my office is we do a series of gentle hands-on techniques that help break up the scar tissue and the muscles, help get the joints moving better, and then either we can refer out to a physical therapist if you were referred to me by an orthopedist or a neurologist, or we can do the physical therapy in-house and teach you some exercises to do at home, which will strengthen the core, support normal joint movement, and prevent you from tearing that disc in the future. And that's how you properly treat somebody. So of the 5 stages, we have relief of symptoms, getting joints to move better, breaking up fibrosis in muscle tissue, exercising and training people on keeping a neutral core, and then the last one is training muscles to strengthen and support the spine. And steps 4 and 5 are done well by physical therapists, and we do work with physical therapists on occasions. But steps 2 and 3 are really best done by a person who's trained in manual therapy techniques like Graston technique and active release technique and gentle joint mobilization techniques. That's it. That's the low back spiel, if you will. So if you're ready to come into the office and find out if you're still at the stage that we can help you, please understand that once you let this go long enough, you can have enough extensive damage in the spine so that you're past the point at which we can help you, and you need to go to an orthopedic surgeon to get a joint fusion. And you don't want to get a spinal fusion because you're going to be permanently impaired the rest of your life at some extent. You know, the days of you dunking from the foul line are over. I don't know if you're dunking from the foul line right now, but you certainly won't be doing it after a spinal fusion. So you got to get to somebody quick before the disc has a chance to die off. So if you want to know if you're a candidate for this very gentle, very thorough low back pain treatment, give the office a call, go to the Contact Us page, find out the directions to get to our office, download our initial forms, give the office a call, and make an appointment. Hopefully I'll be able to meet you one day in the future, but until then, take care. Hope you enjoyed the nice briefer lecture, and have a good day.